Hello everyone, my name is Dr. DeLuca. I'm over here at our West 26th Street office. I wanted to give you a few tips that you can take home before you end up coming to our exam room being in lots of pain. So when we're treating a patient, oftentimes what you're seeing on the news and some of these infomercials about inflammation does hold true. There are certain things in the world that are very pro-inflammatory and certain things in the world that are anti-inflammatory. And so I'm going to give you a list. I did another video on our laser room, but let's talk just briefly about a few of them. So what are some things that we see with patients that are more common? So when you come in, you have low back pain. If you go through our database, we have a high percentage of smokers compared to what we have, say, in Erie. And the reason why is because smoking is very pro-inflammatory, and you're more likely to get low back problems and low back pain from that. Okay? And so when we're treating you, the chiropractors are using therapies and treatments to help combat some of that. And so if you are a smoker, what are some things you can do that help counter that? And I would say you'd want to avoid sugary foods and processed foods. If the ingredients are too long and for you to read and understand, it looks like a bunch of organic compounds. It probably is. So you want to avoid those. And I would say the third tip would be increase your water load by a lot. The discs in your low back are mostly water, if I got the spine over here, if you look at the discs, they dehydrate. When we X-ray, you will see decrease in disc height because over decades they dehydrate, degenerate, and so increase your water load as much as you can. I've never met a chiropractor that doesn't think that increasing your water load is bad for your back. We all think that's an excellent thing that you should do. I would say, and then eating right. Staying away from sugary soda pops, diet soda pops, and processed chemicals, and then just going back to water, and then your caffeine intake. If your caffeine intake is very high, you're dehydrating your body because for every cup of coffee you drink, your body has to flush out more water than you take in, and so that's why you can't drink 5 cups of coffee, jump in the car, and drive from here to Pittsburgh. You're probably going to have to stop a couple times. And so because you're flushing water out of your system and actually dehydrating your body. And so when we're talking to patients and we're working them up, these are things that we see in their chart very frequently, and they're contributing factors to a lot of these things. A lot of our patients will have type 2 diabetes to go along with all these problems. And so these are some tips that you can use before you come in the office to help avoid the problems. Now, if you have some of these back problems and neck problems that we treat, we're happy to take care of you, and I promise you our chiropractors are going to add and mention, the adding water and some of the things that we're talking about. All right, thanks so much.